Are you dizzy yet? I certainly am. That's the so-called science we have in serology in the field of using antibodies. What are antibodies? What do they mean? And how reliable is the testing to tell us if we are sick or if we are immune or protected? So let's break this down. Once we do, we are going to then discuss ASO titers, which are the antibodies measured in strep cases. Typically, when you get tested for infectious diseases, it's an antibody test. This is an indirect test. It does not measure the level of actual microbes. A lot of people might not know this. They claim to measure the patient's antibody response to the so-called infection, not the claimed infection itself. So if we want to understand how valid this type of indirect test is, we of course have to go down the trail of research, as this is the very research that supposedly backs these types of tests and the overall reasoning. Conventionally understood, antibodies are proteins of the immune system that neutralize intruders such as bacteria and viruses and fungus and parasites. There are 5 main types of antibodies, generally speaking: IgA, IgD, IgE, IgG, and IgM. After deep research, I now know that this model relies on massive presuppositions, which is not based on any substantial evidence. However, to keep this video succinct as much as I can, rather than deconstruct again the issues with all of their assumptions, let's just move forward within their paradigm. Let's speak their language. Based on the very conventional research of antibodies, what can we say these antibodies provide in terms of giving us information on disease and diagnosis? The research of antibodies is called serology. So whenever you hear me reference serology, we're talking about the field of research that studies antibodies. In general, the classic understanding is that IgM antibodies rise in the acute phase of disease. They come on first when we first become infected. Then after that, after we leave the acute stage, IgG antibodies are regarded as the protective antibodies that can remain elevated for long periods of time. These are considered the ones that make us immune to specific infections. It's been demonstrated repeatedly in their research that instead of binding to the desired target, antibodies can attach to similar or completely unrelated targets. And the research labs don't even validate this in the majority of cases, really, if any. These issues are openly admitted in conventional medicine when you look close enough. This is what Clifford Sapper, previous editor-in-chief of the Journal of Comparative Neurology, had to say about this issue. It is alarming then to discover that antibodies can be unreliable reagents. Insufficient specificity, sensitivity, and lot-to-lot consistency have resulted in false findings and wasted efforts. Antibody unreliability has taken its toll across studies in cancer, metabolism, aging, immunology, and cell signaling, and in any field concerned with researching complex biomolecules. The waste in terms of time and resources is colossal. Losses from purchasing poorly characterized antibodies have been estimated at $800 million per year, not counting the impact of false conclusions, uninterpretable or misinterpreted experiments, wasted patient samples, and fruitless research time. End quote. Wow, I mean, I could end the video right there. Their top researchers are starting to call this major issue out with the validity of using antibodies across all research fields. But these procedures, the tests, and the reagents are used continuously in all of research. I don't know that people can really grasp how monumental this is. We have been taught to believe in some disease, antibodies offer so-called protection, such as in measles, for one example. But in others, it can mean you have a death sentence, such as in HIV. So let's talk about some of the major contradictions in the field of serology. First up, conventionally, we are told that IgM antibodies mean you have an acute infection with that specific disease. Well, here in this study and many others we see, high levels of antibodies was actually not specific. Quote, overall, a high level of HEV, EBV, and CMV IgM cross-reactivity was demonstrated, indicating that serology is unreliable in the diagnosis of acute viral hepatitis. That's just one example of many like it with other so-called diseases. In other words, IgM antibodies elevated non-specifically even in those without the so-called viral infection. Here's a list of the many reasons and causes of elevations in antibodies. Things like B-cell activation, a heightened immune response, autoimmunity, pokes, issues with the testing process and validity, and several more factors can contribute to these false positives and issues with using antibodies at all. If all of these things can elevate antibodies, how can we ever use them to tell us anything at all, like if we are sick or if we are healthy or if we are protected? The next contradiction in conventional understanding is that you may have IgM antibodies in the acute disease stage, but if they are present longer than 30 days after the symptoms began, they are meaningless. This is their understanding. Take this example for Lyme disease, my favorite topic. The CDC writes, quote, some tests give results for two types of antibodies, IgM and IgG. Positive IgM results should be disregarded if the patient has been ill, symptomatic, for more than 30 days, end quote. Next, the conventional understanding is that if you have high levels of IgG, it can either mean you have an active infection, an old infection, or a resolved infection after treatment. Take your pick. The issue is that it's known that these antibodies can stay elevated for years or indefinitely. There's literally no way to know except to look at the person and use your best judgment as a clinician, if they are sick or not. Then all you have to do is classify them according to the type of symptoms they have, and bam, you have your diagnosis. No unreliability antibody test needed.
Okay, Sally, we got your results back and your antibodies were elevated. And since you look sick, it must confirm that you are indeed sick.
All right, but for you, Johnny, it looks like your antibodies were elevated, but you don't really have any symptoms and you don't appear sick to me. So I guess in this case, it means you're not sick.
Again, the CDC tells us that, quote, antibodies normally persist in the blood for months or even years after the infection is gone. Therefore, antibody tests cannot be used to see if someone is recovered or not, or if treatment has worked. So, okay, let's back up. Let's make sure we have this crystal clear. Elevations of these antibodies for viral and bacterial pathogens will rise if you're acutely sick. Okay, got it. But they can stay elevated even after you're no longer sick and can also remain high when you were treated with the appropriate treatment.
I'm confused.
So you tell me, how do we know when you're no longer infected? And how do we know that the rise and fall of antibodies actually mean anything associated with being sick in reality at all? Your medical doc will openly admit that persistent antibody formation is not proof of a persistent infection. So we're starting to get it. Well, we are starting to see, rather, that there is a constant conflict in information. In some cases, antibodies mean you are protected. In some cases, it means you are very sick. In some cases, it's completely meaningless. Are you dizzy yet? I certainly am. That's the so-called science we have in serology in the field of using antibodies across multiple fields of research. That's what they have to offer based on this advanced serology and their testing. So now that we see all the contradictions in this field of serology and in general with antibody testing, let's talk about the ASO titer, another antibody test. What is an ASO titer? This is an antibody test that is associated with strep. It's also associated with PANDAS, a syndrome afflicting children. We're told that ASO, anti-streptolysin O, is an antibody produced to fight a toxic enzyme of group A strep. This antibody is measured to see if you are infected or have been infected recently. The narrative is that this antibody test measures how much ASO is in your blood, Now, in functional medicine, the belief is that the higher the ASO titer and the higher it remains for longer periods, the bigger the issue is for certain patients. But how accurate or useful is this antibody test? In this 2017 journal article, they write, quote, "In such cases, a single set of ASO and ADB levels might be obtained, but should be interpreted with caution, since a positive value may reflect a strep infection that occurred in the remote past, unrelated to present symptoms, whereas negative titers are obtained in as many as 40% of strep infections. Given these uncertainties, it is often difficult to establish," end quote. How about this paper that states, quote, "These data also unexpectedly revealed that even in the culture documented absence of strep, meaning that the culture was negative, ASO and ADB titers may remain elevated above the established levels for extended periods of time," end quote. They go on to say, "Conversely, it is not uncommon to encounter individuals with quite elevated titers, often greater than the published set values, that remain high for many months, even in the document absence of group A strep," again, meaning even in negative strep cultures. Okay, so there's the rundown on the vast variability with these antibody tests. So, what is a more plausible hypothesis for what these proteins are up to in our system? Is there a more likely explanation for why these antibodies rise in our blood if they do? Here's a statement I really liked on antibodies from researcher and virologist Dr. Stefan Lanka. He writes, "The body's reaction when cells break down is to form sealing substances, globulins, small proteins, even if you get a blow on the muscle in case of a bruise or a blow on the kidney or in the liver. There is an immediate increase in antibody titer. The body reacts by sealing the damaged cells and sealing naturally growing cells. This antibody binds to all sorts of things. You can manipulate this in the laboratory by changing the acidity, adding detergents that change the mineral concentration. The blood of a pregnant woman, for example, is full of globulins to seal the placenta. The blood of a pregnant woman must be diluted 40 times to prevent her from being massively positive in these antibodies tests, such as the HIV test," end quote. Okay, this makes a little more sense, considering that multiple situations allow for elevations of antibodies. For example, pregnancy, as he mentions, will cause elevations. Tissue injury definitely does. So we see that a rise in antibodies does not equal a direct correlation on so-called infections or immunity. As I've covered already, antibodies can rise for all kinds of reasons. But in conclusion, I want to show you just how many factors can elevate these proteins. So what else has been shown to be associated with an increase in antibodies? Even in the conventional research, let me just show you a few. First up, how about a rise in seemingly unrelated antibodies and heart attacks? This is something that shows up again and again in the literature. This paper notes that, quote, "Elevated IgG and IgA levels were first described in the serum of Crohn's disease patients and have been increasingly reported in other inflammatory diseases." Okay, so we see a rise in these proteins with severe damage to the gut and other inflammatory processes. Okay, got it. They go on to write that, quote, "Elevated IgA, IgG levels in acute heart attacks might suggest use of these antibodies as a marker for atherosclerotic plaque instability. It might also provide a link between inflammatory processes and increased cardiovascular risk," end quote. Next, here's a paper on the increase of autoantibodies in those with previous heart attacks. They write that IgM and IgG autoantibodies were significantly higher in patients as compared to controls. Further, patients who got an invasive treatment had even higher levels of these autoantibodies as compared to patients who only had standard medical treatment. So in other words, for those who had a history of heart attacks, they had higher levels of these autoantibodies, and those who had more invasive treatments had even higher levels of autoantibodies. So you can see the picture starting to come together that these antibodies, these proteins, appear to increase in all kinds of tissue damage or injury. How about this next paper? It shows elevated C. pneumoniae antibodies in patients with heart attacks again. Quote, "Adverse cardiovascular events was recorded and shown to increase with antibody titer." So just more elevations of antibodies for those with heart attacks and tissue damage. And circling back around to those ASO titers in regards to strep, this paper showed a quote increase in ASO titer in relation to valve involvement, meaning when there's damage to the heart valves, they saw an association with a rise in ASO titer. Again, more tissue damage. We saw this with rheumatic heart disease in one of my videos for strep. Damage to the heart, even without any clear history of so-called infection or evidence for one, does appear to cause a rise in these antibodies. Okay, so there you have a good synopsis. We see an increase in multiple types of antibodies for multiple inflammatory processes and tissue damage. We see that there are many contradictions in the medical model itself in regards to these very proteins. On one hand, they claim antibodies are protective. On the other hand, they say they are dangerous. It's apparent that in many cases, there is no clear guideline on what these proteins actually offer in terms of utility. It always comes back to the quote, clinical diagnosis, as they say anyway. The antibodies are meaningless if a person doesn't appear sick, unless of course they tell you that you have HIV or another very dangerous virus. Then you just may have a death sentence at that point. I urge people to understand just how, I dare say, useless it is to base vital health decisions on these arbitrary values, markers, and models. Antibodies, if anything specific at all, appear to be simple proteins that are innate in our body to restore tissue, restore membranes, and to aid in the helpful inflammatory cascade during injury, toxicity, and waste removal.